Cochlear implant is a device kind of like a hearing aid, but it's much more in depth. What it is an actual device with an electrode that we insert into the cochlea, and it actually produces electrical signals that make you hear. So as opposed to a regular hearing aid where you have a device that amplifies the noise, this actually changes the noise into an electrical impulse, and then that is heard as sound by the cochlea and then by the brain. The characteristics of a patient that would benefit from a cochlear implant has to do with how well they've done with a hearing aid. So a hearing aid is a very good device with the majority of patients that have hearing loss, but when they have been using hearing aids for years and they're basically at a point where the hearing aids just are no longer providing any benefit, that's when we need to start talking about a cochlear implant. Cochlear implants work both for children and adults. Normally in children, they are what we call prelingual when they have a hearing aid or a cochlear implant performed. So they've never had hearing. And if we get them when they're very young, they have excellent results. The same thing goes for adults. If we get them right after they lose their hearing, the closer we are to the hearing loss or the point where they no longer have benefit from a regular traditional hearing aid, the better they do with a cochlear implant. Cochlear implants don't do very well for patients who have been deaf their whole lives. So an adult who has never heard, that part of the brain just doesn't function, and it's a kind of use it or lose it phenomenon. We have found that there can be a decent amount of time between hearing loss and cochlear implantation and there still be a benefit, but it is extremely variable the longer we go from the actual hearing loss date. So cochlear implant is different from a hearing aid in the fact that hearing aids amplify sound, and it's still relying on the cochlea to hear. What a cochlear implant does is it bypasses that mechanism, and we directly stimulate the nerve fibers in the cochlea so that that is then perceived as sound by the brain, in which the hearing aids at some point no longer become beneficial because of the damage, and we can actually bypass that with the cochlear implant. There's many factors that go into how much improvement a patient's gonna have from a cochlear implant. One of the big factors is how long they've had that hearing loss and how severe their hearing loss has been. If they still have some speech recognition and they haven't had hearing loss for many, many years, then they actually have a very, very good chance of having the ability to have open sentence speech recognition, which means that they can talk on the telephone. And this is taking many patients who have never been able to talk on the telephone for years and years and years because of how bad their hearing loss is. And they can actually hook the cochlear implant up to their iPhone and via Bluetooth can talk on the telephone, which is something that these patients notice the most out of their recovery. As far as different sounds, sound awareness is a big thing. So just hearing a car come down the road for a safety standpoint, hearing a siren. Music has always been a problem with cochlear implants. Music appreciation kind of gets better and better with the technology, but that is one thing that patients definitely state, is that music just doesn't sound right. And we haven't figured that out yet, but the technology advances by about double every 5 years. A patient should be able to talk on a telephone and should be able to listen to television. And there's multiple different components that go into a cochlear implant. So after the patient has had the cochlear implant, part of the programming is nowadays connecting it to their phone. So there is an app that's internal to the phone, just like any other app you would download, that helps you control your cochlear implant. There's also external mics. So patients who are at school, in college, they can actually have their professor wear a mic that directly links to their cochlear implant, which is extremely beneficial. There are really no activities that someone with a cochlear implant should avoid. Contact sports, maybe not, but the risk of that is very low, but it's real, so that would be something to consider. Other than that, they actually make waterproof receivers for the cochlear implants, which most patients aren't going to want to wear them in the water anyway, but that is available. But once the surgery is performed and the patient's healed, there's really no limitations to their activity.